Come in.
Hi, my name's Heather. I'm going to be your nurse today. I'm going to wash my hands, do hand hygiene, and put gloves on. My name's Heather. I'm going to be your nurse today. I'm here to do a musculoskeletal and neuro exam. Does that sound okay with you?
Yeah.
Alrighty. Can I get your full name and date of birth?
Max Erdwin, August 24, 93.
Alrighty. Sounds great, Max. Alrighty. So, Max, can you tell me, do you have a family history of arthritis or osteoporosis?
Yes, my mom and her mom have arthritis.
Okay, so your mom and her mother have arthritis.
Mm-hmm.
Okay, and you said no osteoporosis.
Yeah.
Alrighty. Do you personally have any joint pain or inflammation?
No.
Alrighty, perfect. How about pain with muscle movements, spasms?
No.
Nothing like that. Alrighty. How about a family history of stroke, MS, anything like that?
Nope.
Neurological. Alrighty. How about you? Any seizures, dizziness? Problem swallowing?
No, not really.
Okay. Any issues with balance, frequent falls?
Mm-mm.
Perfect. Alrighty. Have you personally ever had meningitis or strokes?
No.
And is there a chance you're being exposed to any environmental toxins either at work or at home?
No.
Okay. Alrighty. Do you find that you're able to perform your activities of daily living to a level that you find acceptable?
Yeah.
Like you're able to mobilize the way that you want to?
Mm-hmm.
Alrighty, perfect. I'm going to move on to a fall risk assessment. Does that sound all right?
Yeah.
Alrighty, so Max, you said you're 25 years old, so that's 0 points. Do you have 3 or more medical diagnoses?
No.
Okay. Have you had any falls in the last 3 months?
No.
Perfect. Do you have any incontinence, troubles getting to the bathroom, or frequent urination at night?
No.
Alrighty. And it looks like you do have some visual impairment. You're wearing some correction.
Mm-hmm.
Okay, so that's 1 point. And you said you didn't have any functional mobility issues. You're able to get around?
Yeah.
Perfect. Any environmental hazards like poor lighting, oxygen tubing, pets, floor surfaces that are cluttered?
I do have a pet.
Okay, that gets in your way?
Yeah, it's underfoot.
Okay. Alrighty, so that's 1 more point. Do you have any pain affecting your level of function?
No.
Okay. And you don't have dementia, Alzheimer's, any sort of cognitive impairment?
Mm-hmm.
Alrighty, so that makes your score a 2. So you were considered not at risk for falls because you would be considered at risk if you had 4 or more. So that is good news. Alrighty, Max, do you know where you are today?
I'm in the hospital.
Okay, do you know why you're here?
I'm here for a musculoskeletal examination.
Alrighty, you know who you are, where you are, and why you're here. So you're going to be A&O times 4, which is great. You appear put together, clean. Your mood is appropriate. I'm able to follow your level of thought. You make sense when you speak to me. Max, I'm going to give you 3 words, and I want you to remember them for me.
Okay.
We're going to do cow, triangle, and cow. Cloud, triangle, cow.
Okay.
Alrighty, remember this for me. Alrighty, Max. Next, I'm going to have you stand up for me, and I'm going to watch you walk.
Okay.
At any point, let me know if you get uncomfortable.
All right.
Are we still going?
Yeah.
Okay, cool. Are we doing 10-minute increments again?
No, this one should be able to record continuously.
Okay, cool. Okay, go ahead and stand up for me. Alrighty, Max. You can take those slippers off too. I know they kind of get in the way. Alrighty, Max. I'm going to have you walk towards me.
Okay.
Just normally. Perfect. You've got a smooth, even gait. Turn around when you walk back. Perfect. It looks effortless, no pain.
No.
So no grimacing or anything like that. Next, I'm going to have you walk heel to toe and just put one foot right in front of the other.
Okay.
It's a little bit tricky. All right, he's able to perform that just fine and stay balanced. That is great. I'm going to have you walk towards me on the tip of your toes.
Okay.
Or tips of your toes. Perfect. He's doing great with that, able to do that appropriately without any struggles. Now I'm going to have you do it one more time on your heels.
Okay.
Perfect. Alrighty, Max, next I'm going to do the Romberg sign. I'm going to have you close your eyes and just stand straight.
Okay.
Okay, so I would have him do this for 20 seconds. This is the Romberg test. I'm going to watch for any swaying or difficulty keeping his balance, and I'm not noticing anything. So that would be a negative Romberg's test after doing that for 20 seconds. Alrighty, Max, can I have your turn around? Would you mind taking your sweatshirt off?
Okay.
Okay, I'm just going to visualize your spine. Is that okay?
Yeah.
Okay, so first step is going to be inspection. Just looking, I'm not seeing any abnormal curvature, no signs of kyphosis or scoliosis. Color is even with the rest of his body. I'm not seeing any masses or anything like that. Max, is it okay if I touch you now?
Mm-hmm.
Okay, I'm just going to touch your spine. You let me know if you feel any discomfort. Anything there?
Nope.
Okay, so no pain with palpation. I'm not feeling any heat, no tenderness. Max, can you take a step back? I'm just going to have you bend forward for me. Bend forward and touch your toes. Alrighty, any pain with that?
Nope.
I'm just checking his final range of motion. You're doing great. Alrighty, you don't have any limited movement or anything like that.
Nope.
Max, do you want to take a seat for me? I'm going to move on to assessing your cranial nerves.
Okay.
The first one is going to be smell. So I'm going to have you close your eyes. I'm going to put a smell in front of you. I'm going to see if you can identify it.
Okay.
Alrighty. Without opening your eyes, can you take a whiff and tell me what it smells like?
It smells like pine trees.
This is rosemary.
Oh.
Sorry, it's a little bit different than yesterday. Alrighty, let's try one more. Can you close your eyes? Sorry. Okay, try this one.
Smells flowery.
Yeah, it's some body spray. Perfect. Alrighty, so cranial nerve 2 is going to be your eyes with your vision. So I would hold a Snellen chart about 14 inches from your face, and I would have you read the lowest line that you can visualize. You can get 3 of them wrong and still be positive for that. So Max is wearing correction, so I would have him do it once without his glasses, one with his glasses, and then we're going to be doing that each time for the left eye and then the right eye as that goes along. So we're going to be skipping that one today. Next, we're going to be assessing cranial nerves 3, 4, and 6. Does that sound okay?
Yeah.
All right. Max, I'm going to have you follow my pen light with your eyes. You let me know if you start to get uncomfortable, okay?
Okay.
Okay. We're just making sure that he can complete all of these movements. There's no signs of nystagmus. He's tracking appropriately, and eyes are both moving at the same time. Alrighty, perfect, Max. I'm going to have you stare straight at my nose, okay?
Okay.
Let me do it on this side. So he's going from a 6 to about a 4. So your pupils are equally reactive and accommodating to lighting. So everything looks good for nerves 3, 4, and 6. Alrighty, next we're going to move on to nerve 7. Can you smile for me? Perfect. Raise your eyebrows. Alrighty. Can you puff out your cheeks? Perfect. Alrighty, cranial nerve 7 is intact. Can you close your eyes for me? I'm going to have you taste something.
Okay.
Can you open your mouth for me? Stick your tongue out. Okay, tell me what you taste.
That's salt.
Okay, sorry about that. That is salt. Great job. Alrighty, Max. Next, we're going to assess cranial nerve 8, which has to do with hearing. I'm going to make noise on either side of your head, and I just want you to raise the hand on the side that you hear the noises.
Okay.
Okay, can you close your eyes for me? Perfect. All right, cranial nerve 8 is working just fine. You're doing great. Next, we're going to move on to 9, 10, and 12.
Okay.
Alrighty. Max, can you say light, bright, tight?
Light, bright, tight.
Can you swallow for me? Perfect. It's salty.
Yeah.
Can you open your mouth for me and say ah?
Uh,
So I'm noticing that his uvula is moving, which means that his gag reflex is intact. Sorry, I'm not sure where I'm looking. Alrighty. Next, we're going to move on to cranial nerve 11 and your cervical spine. Can you shrug for me? Perfect. Now I'm going to push on you and have you shrug. Alrighty, perfect. One of the things I forgot to do was check you for TMJ. Can you open your mouth for me? Perfect. I'm not feeling any clicking, so no signs of TMJ. Can I have you close your eyes again? Alrighty. This is going to be cranial nerve 5. Max, I'm going to rub some cotton along your face, and I want you to say now when you feel it.
okay. Now. 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 Now.
Okay, so it's cranial nerve 5. You can open up your eyes. Alrighty, so we have assessed all of the cranial nerves. So back to 11. Sorry, I'm jumping around a little bit. So with 11, I'm also going to test your cervical spine. Can you move your head into my hand? Okay, and twist for me. Can you turn your neck? Perfect. All right, so cervical spine is working just great, the way we like to see it. Alrighty. Max, I'm going to be taking a look at your shoulders. Is that okay?
Mm-hmm.
All right. So I'm just going to look at his shoulders. Preferably it would be without clothing, but today we're just going to be pretending. So I'm going to look to make sure that the skin is the same color as the rest of your body. No signs of lumps or anything like that. Is it okay if I touch?
Mm-hmm.
Okay. So I'm just going to be feeling his shoulders for symmetry. Are you having any pain?
No.
Okay, everything feels good. No lumps, no heat. Like I said, no redness when I was looking at him. Max, can you raise your arms up for me? Okay. How about do some circles? Alrighty, and are you able to put your arms behind your back? Perfect. Any pain with that?
No.
Alrighty, so shoulders look great. Can I move on to your elbows?
Okay.
Just looking at them. No signs of redness, no nodules, no signs of asymmetry. Is it okay if I touch them?
Mm-hmm.
Alrighty. I'm just going to be feeling them, making sure everything feels symmetrical, that there's no warmth. Max, can you bend and stretch, flexing and extending those arms? Great. Hold them like this for me. I'm going to have you bring me towards you. Okay, push me away. Alrighty, great. So that's elbows. Next, we're going to move on to your hands and wrists. All right, Max. I'll have you flip them over for me. All right, I'm just looking. I'm making sure that everything is the same color. There aren't any lesions. I'm not seeing signs of any trauma. No discoloration. And I'm just going to feel all the joints, okay?
Okay.
You let me know if you have any discomfort. Alrighty, just kind of feeling everything. Everything feels good, no warmth, no asymmetry, nodules, anything like that. Alrighty, next I'm going to do a couple tests with your wrists. Alrighty, sorry, it's kind of late. Alrighty, Max, I'm going to assess your grip strength. I'm going to take my hands like this. Can you squeeze both of them? Give him a good squeeze. Alrighty, he's got good strength in both hands, and that's what I'm looking for. And his grip strength is equal. Alrighty, Max. We're going to do some rapid alternating movements just to make sure everything's working. I'm going to have you take your thumb, touch it to each finger. Alrighty, and speed it up for me. Awesome. You're doing really good. Perfect. Max, next I'm going to have you put your hands on your thighs and flip them over. Speed it up. Alrighty, he's doing just great. Movements are smooth and fluid. Alrighty, Max, I'm going to have you close your eyes and stick your hand out. I'm going to write a number on there, and I want you to see if you can tell me what it is.
3.
Yep, that was 3. That's the graphesthesia test, and you were able to identify, so that is great. Max, next I'm going to have you close your eyes. I'm going to put an item in your hand. We're going to see if you can tell me what it is.
Okay.
Alrighty, go ahead and feel that.
It's a spoon.
Awesome. Yep. That is great. Okay, next I'm going to be doing Chanel sign. Can you put your hands up for me? I'm just going to do some tapping along here. Let me know if you feel any zinging pain, anything like that.
No.
Okay, feeling both sides, top and bottom. So that is a negative Chanel sign. Next we're going to do Phelan's. I'm going to have you hold your hands like this. There we go, just kind of let them dangle. I'll have you hold that for a while. You let me know if you start to feel any discomfort, any tingling, anything like that, especially in the first 3 fingers. That's usually indicative of carpal tunnel.
Okay.
You feeling okay?
Yep.
Alrighty, so we're going to call that a negative Phelan sign. In a clinical setting, I might have you do it a little bit longer. Would you mind standing up for me?
Okay.
Next, I'm going to be moving on to his hips. Now, in a clinical setting, I would want to visualize his hips and be able to palpate them, but today, just for Max's privacy, we're going to be skipping that. It would be the same thing with all of the other joints. I would just be looking to make sure that they are symmetrical, that there's no signs of trauma, no nodules, anything like that. No tenderness, heat, no swelling, anything like that. Alrighty. Max, we are going to assess the range of motion in your hips. Can you stand on one leg for me? Kick your knee as high as you can. Perfect. Hold that. Alternate. Awesome. And can you do a deep squat? Perfect. So his range of motion in his hips is looking great. Alrighty, Max. Thank you. Alrighty. I'm going to keep moving down your body. I'm going to move on to your knees. So before touching, I'm just going to be looking at them. I'm going to check for any redness, asymmetry, anything like that. Max, is it okay if I touch them?
Mm-hmm.
You let me know if you have any tenderness. Everything feels symmetrical. There's no heat. His patellas are freely movable. So that is what we like to see in those knees there. Max, can you bend your knee and stretch it out for me? Perfect. Flexion and extension. He's able to do full range of motion in both legs. Awesome. Alrighty. Max, I'm going to move on to your ankles now.
Okay.
I'm just going to visualize them, make sure I don't see any swelling, asymmetry, redness, anything like that. Not seeing any lesions. They're looking pretty good. Max, is it okay if I touch them?
Mm-hmm.
You just let me know if you have any tenderness. I'm not feeling any heat. Everything's feeling symmetrical still. We're doing great. Alrighty. Max, I'm going to move on to your feet. I'm going to look at them. Look at both of your feet. Not seeing any asymmetry, redness, nodules, anything like that. Is it okay if I touch them?
Mm-hmm.
Okay, I'm just going to touch all the joints. Alrighty. You're not having any tenderness?
No.
Okay, perfect. So no tenderness, swelling, heat, nodules, anything like that. Max, can you flex your toes for me? Flex, extend, perfect. You're doing great. Can you spread them apart? Alrighty, cool. So he has got full range of motion. Now, if we had all the tools today, we would be doing a vibration test. So I would have a tuning fork with the little vibrator things on the end of them. I would hit it and I would put it on your great toe. I would ask you to tell me when you feel it start and when you feel it stop. And that would be a normal sign, as if you could feel it in your feet. If you weren't able to feel it on your feet, I would move it up to your ankle. And if you weren't able to feel it in your ankle, I would move it up to your knees. But anything other than feeling in your foot would be considered an abnormal clinical sign. Alrighty. So Max, another test we like to do is to see if you have sensation in the bottom of your feet. So today I'm just going to be using a pointed end of a popsicle stick, and I'm just going to have you tell me when you can feel this on the bottom of your foot. So Max is a little bit ticklish, so we're not going to be doing 10 spots today. He's been nice enough to let me assess him. Alrighty, Max, when you feel it, I want you to say now, and try to just look straight.
No.
Perfect.
No. 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 No.
Alrighty, so we would want to do that 10 times just to make sure that he has sensation on the bottom of his feet. Alrighty. Max, the next thing we're going to be doing is to test your pain sensation. So I've got a broken popsicle stick. This one doesn't have the pointy end on it. And I'm going to have you tell me when you feel dull versus sharp, okay? So this is going to be sharp. This is going to be dull. I'm only going to use your arms today because that's what's on camera. Alrighty, so go ahead and close your eyes for me, and I just want you to say if you feel dull or sharp.
Sharp. Dull. Sharp. 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 Dull.
Alrighty, perfect. So he did get it right every time. So that's great. Do you have any questions for me today, Max?
No.
Alrighty, so the one other thing we would be doing if we were in a clinical setting or if we had all of the equipment was I would be checking your deep tendon reflexes. So with that, I would do your Achilles, your quadriceps, and then your biceps and triceps. What we would consider a normal tendon reflex would be a 2. If we felt it move, but a little bit less than what we'd like to see, that would be a 1, and we would consider that diminished. And let's say he had a hyperactive jerking response, we could call that a 3. So I think that pretty much wraps it up for today. I'm going to wash my hands, make sure that you're safe and comfortable. And you said you don't have any questions for me today.
No.
So I think that about wraps it up.
All right,
Alrighty.
thanks.
Thank you, Max.